Nevada is being eyed as one of the states being closely monitored statewide. The states in the darkest blue, including Nevada, have had the highest case jumps in the past 7 days. So we are third behind Louisiana and behind Florida. We are also one of the highest states right now, Nevada and Arkansas, for community transmission. Doctors in Nevada hospitals are concerned about what they're seeing. More people and younger people getting sick, and the vast majority are not vaccinated.
An uptick in people with severe infections and people who do need to be put on ventilators. We feel terrible for those patients and for their families.
Dr. Hansberg of UNLV School of Medicine treats patients in the ICU at UMC. She says she sees the effects on COVID variants on patients' health. The Nevada Hospital Association says hospitals are well equipped for any spikes, but we are at the start of a resurgence. As of Monday, there are 440 people in Nevada hospitals. That's more than double the numbers from late May and early June.
People seem to be getting sicker a little bit faster than what we saw earlier in the epidemic, need to be put on a ventilator sooner. The patients that we've had the last couple of days do seem to be younger.
Dr. Hansberg says new patients are younger, by far unvaccinated, and get sick much quicker. She says the more infectious Delta variant is a factor. The Southern Nevada Health District reports 95% of people checked into Valley hospitals have not had a vaccine, and younger adults are driving this new spike in cases.
In terms of some breakthrough medication, we're just not there yet.
Though there are many trials for medicines for COVID, the options are still limited, from remdesivir to monoclonal antibodies to steroids.
The vast majority of people getting vaccinated will protect you from having severe COVID.
Has any patient ever said, I regret not getting the vaccine?
Yes, unfortunately, we hear that quite a bit in the ICU. A hard conversation with family members as well.
There is a new treatment in the past 2 months. Patients who are very sick and high risk, they can avoid a hospital stay with an antibody cocktail through an IV, but it's only given when they go to the ER. The Hospital Association expects by mid-July, Southern Nevada alone will have 450 COVID cases in hospitals.